Presenting Lifespan Development in Infancy by Shauna Muramarco. The term infant applies to babies from birth to around 1 year of age, but some definitions may include those up to 2 years of age. For the purpose of describing the developments that occur in infancy, focus will mainly be placed on the ages between birth and 1 year of age, but will also include pertinent information from the year 1 until 2 year age range as well. The purpose of this presentation is to evaluate the emotional, social, and moral developments that occur throughout infancy, the theories behind these developments, and how they may affect decision making. There are a few key terms that will be focused on in each area of development. Emotional development will focus on the development of the primary and self-conscious emotions, as well as non-verbal encoding, stranger anxiety, separation anxiety, and social referencing. Social development will mainly focus on the concepts of temperament and attachment. Lastly, moral development will focus on the stage of development termed pre-conventional reasoning. Emotional development occurs throughout the lifespan and describes the intensity and balance of experiences specific to the individual. Since human beings, according to Schreiner and Schreiner 2014, experience a variety of emotions, these experiences can differ from person to person. The first set of emotions that an infant is able to express are feelings of joy, anger, sadness, and fear. These emotions, and others like them, are known as primary emotions because they are innate to human beings and have been seen throughout cultures. The second set of emotions that an infant develops is known as self-conscious emotions. These can typically be seen in infants from around 6 months of age and show that the infant is now self-aware. Emotions that require self-awareness are ones like empathy, jealousy, pride, and guilt. Nonverbal encoding is also an important aspect to look at when considering the emotional development of infants, because it describes their ability to express their emotions without words. This is also considered to be an innate ability and is found across cultures. However, the ways in which these emotions are expressed differ in the levels of intensity across cultures. This nonverbal encoding also allows infants, once they are around 2 months of age, to interpret others' emotions. Before this age, they do not have eyesight strong enough to depict the facial expressions of others effectively. By the end of an infant's first year, different emotional reactions start to become present. These are known as stranger anxiety, separation anxiety, and social referencing. Developmentally, infants are now able to discern between people that they do not know and people that they do know. They may become cautious or wary around a person who is unfamiliar because they are not able to predict what will happen with them. This is known as stranger anxiety. The fearful reaction emitted from infant to infant will differ in intensity, but has been seen across cultures. Separation anxiety and stranger anxiety are often confused with each other as they may be occurring at the same time. While stranger anxiety relates to an infant being with an unfamiliar person, separation anxiety relates to an infant being away from their primary caregiver. This anxiety tends to start around 7 months of age and peaks around 14 months of age. Infants, while learning how to express their emotions in general, start to express themselves in terms of others' behaviors, which requires that the infant is first able to understand the meaning of another person's behavior. This tends to start around 8 months of age and is known as social referencing. Social development for infants is focused around two main concepts, which are temperament and attachment. Temperament is known to affect how social an individual is and is noticeable from early infancy. It describes the patterns of arousal and emotionality in the infant, which may include aspects like adaptability to new situations, responsiveness, cheerfulness or unpleasantness, and their ability to be soothed. Temperament is known to be determined by both genetics and environmental factors and have been broken down by two main theories. The first main theory that governs temperament in infancy is the Thomas and Chess classification, which breaks temperament down into three main categories. These categories are easy, difficult, and slow to warm up. Easy infants are known to have regular sleeping and eating habits, and they approach new situations with enthusiasm. Difficult infants have irregular sleeping and eating habits and approach new situations slowly. Many times they have a difficult time adjusting to new situations and people and respond with tantrums and crying. Infants in the slow to warm up category show a combination of habits described in the easy and the difficult temperamental infant classifications. The second main theory that governs temperament in infancy is the Rothbart and Bates classification. They also broke down temperament types into three different categories, sharing similar traits. The first category is called extroversion or urgency and is characterized by positive anticipation and sensation seeking seen in the infant. The infants in this category are impulsive, but may still react to unfamiliar people and situations with avoidance tendencies. Infants who fall into the negative affectivity temperamental category are often characterized by fear, sadness, frustration, and discomfort. These infants are easily distressed. Lastly, infants that fall into the effortful control category are characterized by the ability to shift focus and have a low-intensity pleasure. These infants have the ability to self-soothe and ensure that their arousal levels stay at an appropriate level for them. Another factor in the development of infants socially is attachment, which can be described as the infant connecting and feeling close with another human being. In order for this attachment to occur, the infant has to be aware that a person still exists when they cannot be seen. This is known as object permanence. Infants would not be able to attach to another person if they thought that those people disappeared as soon as they were out of sight. There are many different theories, ideas, and concepts that revolve around infants and attachment. Freud believed that infants were in the oral stage of development and that the infant bonded specifically with the mother due to the feeding and nurturing of the infant provided by her. He thought that the nursing of the child enabled the satisfaction of the oral stage and created that bond or attachment. Erikson believed that the infants were in the trust versus mistrust stage of development and therefore were constantly looking for the person who was going to be consistently meeting their needs. This is what he believed created attachment, the knowledge that this person would meet the needs required when they were announced. Harlow, who experimented with baby monkeys, found that humans' attachment is not based solely on food and that there is some sort of built-in need for contact comfort. Ethologists who studied behavior noticed that a pattern of reciprocating needs and affection create a mutual attachment between the caregivers and the infants that helps to ensure the infant's survival. Because of this, they believe that this attachment is an instinctive response. As with temperament, the levels of attachment can be broken down into different types of attachments, which were initially described by Ainsworth through the Strange experiment. It was found later that there are 4 types of attachment. 3 were initially described and 1 was later added. These are secure attachment, avoidant attachment, ambivalent or resistant attachment, and disorganized, disoriented attachment. Securely attached infants are found to protest their mother leaving, but were easily comforted upon her return. These infants are known to be happier, more sociable, and more cooperative, which may be due to having parents who are more affectionate, cooperative, and predictable. The remaining attachment categories are all insecure attachments. Avoidant attached infants are not distressed upon the mother leaving and ignore her upon return. Ambivalent or resistant infants are extremely emotional when the mother leaves, but when she returns, the infant seems undecided about whether they want their mother to love them or leave them alone. Disorganized, disoriented attachment, which was later added to the categories of attachment, described infants who are initially confused when their mother leaves, and upon return they emit behaviors which contradict each other. Infants progress through different phases of attachment development, which in infancy are called the pre-attachment phase, which lasts from birth to 6 weeks old, the attachment in the making phase, which lasts from 6 weeks to 6 to 8 months old, and the clear-cut attachment phase, which lasts from around 6 to 8 months until around 18 months to 2 years of age. During the pre-attachment phase, infants use their innate signals to become close with other humans and caregivers. There is no attachment at this phase, even though they are able to recognize their mother's smell, voice, and face. That being said, infants at this age can be soothed by any adult. During the attachment in the making phase, an infant starts to recognize the difference between familiar and unfamiliar caregivers and responds differently to each of them. They are no longer able to be soothed by any adult and will prefer someone who is familiar, like a mother or father. However, they will not protest or experience any anxieties from separation at this point. Familiar caregivers simply have started to create trust with the infant by understanding the signals that the infant is giving and responding to them consistently. During the clear-cut attachment phase, attachment becomes clear and signs of separation anxiety can be seen when the infant is away from the primary caregiver. Closer to toddlerhood, infants will use the primary caregiver as a secure base to explore the world around them. They feel safe knowing that their caregiver is within eyesight, but would protest if the caregiver attempted to leave. Moral development, which refers to the understanding between right and wrong, does not occur substantially in infancy. This requires a lot more development than infants normally have at this point, as it is shown through their behaviors, thoughts, and actions. However, towards the very end of infancy, moral reasoning may be seen. Surin et al. Even suggest that infants may be able to attribute a goodness trait linking the domains of fairness and prosocial actions. So further research may see the start of moral understanding earlier. However, the first stage of moral development is known as pre-conventional reasoning stage, and this is where moral reasoning, behaviors, and thinkings are influenced specifically by punishments. Decision-making in infancy revolves around the concept of understanding emotions, temperament, attachment, and moral reasoning. The ways in which infants act or make decisions in the beginning have a lot to do with innate abilities. Infants are born with their primary emotions, their temperament, and their ability to form an attachment. These initial decisions have the goal of ensuring the survival of the infant. As infants develop, they attach more heavily to their primary caregiver because they know that they will provide for and keep them safe. In order to create healthy infants emotionally, cognitively, and morally, 3 main rules of thumb can be followed. The first is to respond to infants' needs consistently. No matter which theory is being analyzed, the response to infants' needs is always highlighted as being extremely important. This allows the infant to form a secure base from which they can learn and grow. The next 2 are to be aware of the infant's anxieties as well as their temperament. This will allow the primary caregiver to give the infant the appropriate amount of adjustment time period necessary to achieve easier transitions. It will allow the infant to stay calmer and feel safe. This concept is known as the goodness of fit, which is described as finding a balance between a child's temperament and the environmental demands of life. Throughout this presentation,